Good day everyone. Today I'll be demonstrating how to start an intravenous infusion. First of all, we have to prepare the supplies and equipments that we need. We have the IV solution. We have to make sure that this is the right one we have on hand. And we also have our IV card, which contains all the necessary information. Attach it here. And then we have also our macro set and our standard infusion set. So we have to make sure that there are no damages or any holes to make sure that we keep the sterility of it. Also have to check the expiration date. And yeah, now we are going to make sure that we have hand hygiene. So put alcohol. Now we're gonna prepare our infusion set, straighten it out, and make sure to close it by adjusting the roller clamp, sliding it in the bottom. We're also not going to remove the caps until the infusion has started. Now we're going to prepare the insertion site of the solution container. Okay, this time, since it is open, we are going to remove the cap of the infusion set and insert it in the solution container. We're gonna twist. Once this is done, we are going to hang it in the IV pole. Okay, now we're going to squeeze the drip chamber to fill it with the solution halfway through. Now we're going to remove we're going to prime the solution. First we have to do is ready of a basin so that we can use it for the drops of the solution. We have to adjust the roller clamp slowly. Okay, and make sure that there is no air. There we go. Okay, and then once it's done, we have to make sure that there are no bubbles. If there are bubbles, we just have to tap it with our finger. Now we're gonna close the clamp and get ready to transfer it to the patient who has a successful injection of the IV needle. So we're gonna get our patient.
Ready? Then we're going to remove the cap of the inlet, make sure it's steril, so this is, and we're going to insert it to the patient.
So this rate, this time we're going to count the number of drops. We're going to regulate and monitor this solution. What we have to do is calculate. At this case, I calculated it to have 20 to 21 drops per minute. First thing we have to do is have a watch so preferably we should have a second hand watch so that we can count the number of drops that is going to take place. So first we have to remove move the clamp slowly upward so that there will be drops. There you go. Once this is done, we will then document all the necessary information that we need, like the date, the site of the venipuncture, the type of gauge, the flow rate, and lastly, the patient's reaction to this infusion. Thank you. Good day, everyone. Today I'll be demonstrating how to discontinue an IV infusion. First, we'll be needing our equipment, wet and dry cotton balls, medical tape, pair of scissors, and a pair of clean gloves. But first of all, before anything else, we should check the doctor's order. Now, I'll assume that I'm on my way to my patient. Good morning, sir. My name is Jan Venser, and you are Mr. Faut. Today, I'll be discontinuing your IV infusion. And because the doctor said that you have taken your medications and you're ready to disconnect it. Before anything else, I should sanitize my hands. On my way, I'll then check the infusion tube if it's closed, and I'll close it, and I will assist the patient to have a comfortable position. Next, I'll put on my pair of clean gloves. Then now we'll check the venipuncture site if there are any swelling or any complications. If none, we're ready to remove the tape that is making the venipuncture site solid. Now we're gonna apply wet cotton ball to the tape to moisturize it. Then we'll now be removing the tape. We can not remove it completely, and we can just put it above the venipuncture site, above the catheter. Once you've done this, put a dry cotton ball above the site and gently remove the catheter from the hand. By doing this, we will gently pull it slowly outward in line with the vein. Once this is done, we can put it above the IV line. Okay, now we're gonna apply medical tape to close the site, and at this point we'll be applying pressure for 2 to 3 minutes. Assuming that this is done, we are now ready to leave and check if there are any damages in the infusion set or the catheter. If there is, we have to report. But if there's none, we're ready to document our findings. This will include the information needed, such as the container, the date and time that it is removed, and the overall client's response. That's all. Thank you. Good day, ma'am, sir. Today I'll be demonstrating how to start in intravenous infusion start using a volumetric chamber. First, we'll need our materials, the IV solution, the volumetric chamber, the IV card, and the medical tape. Before anything else, we should start by sanitizing our hands. First thing to do is put the IV card in the IV solution and check the sterility and the integrity of the infusion set. First thing to do is check check the expiration date, and once you open it, we should check if the cover for the inlet and spike are present, and we should make sure to put the roller clamp close to the volumetric chamber. This is the one that connects to the patient. And the one that connects to the volumetric chamber, the roller clamp there, we should also close it. Once this is done, we can now insert the spike into the IV solution. First, we'll open the IV solution. Once it's open, gently remove the cover for the spike and gently twist it inside. Avoid also touching the rubber stopper to remain the sterility of the solution. Once this is done, we can now hang it in our IV pole. Now, we have to prime our the first chamber. This line. First thing we need to do is fill the chamber 20 to 30 ml. We do that by opening this roller clamp. Sorry.
Just pag matalo.
Once this is done, you can close the first roller clamp. And now we're gonna prime the tube that goes through the patient. By doing this, we will squeeze the chamber by allowing the fluid to flow halfway through. Once this is done, you can now stretch the IV tube and make sure that there are no bubbles. should allow the fluid to flow through. Just a little bit. Once this is done, we are now ready to bring this to our patient and connect it to them. Thank you. That's all.